My name is Brian Matthews. I'm Housing Commissioning and Partnership Manager at London Borough of Camden. I've come to talk to you about a project called Camden Housing First, which I hope you'll find interesting. Just to give you some context, what this is about how accommodation is provided for rough sleepers and single homeless people with support needs, and where the support needs are usually around substance misuse and mental health problems. And essentially there are two main accommodation models for this kind of client group. One is a staircase or pathway model, which is quite common in this country, and the other is a housing first model, which is still quite rare in the UK. Camden was actually one of the first local authorities in the country to launch a pathway model back in 2007, called it the hostel pathway. Many other local authorities have adopted similar kinds of approaches since. Within Camden we have a lot more services than a lot of other local authorities, 700 beds, 19 services, 7 providers. Just quickly to explain how the pathway works, it has 4 different stages and each of those 700 beds is designated as being one of those stages. So someone might come into an assessment bed, stay there for 8 weeks, have their needs assessed, then move on to one of the other stages. We have specialist support beds that address drug and alcohol use or offending behaviour or domestic violence, engaging support beds to provide a period of stability while people consider their housing options, and then a move through stage where people are given the skills and knowledge to move on and live independently. The pathway, since its introduction in 2007, has been very successful, but there has been a small but not insignificant group of service users with complex needs and challenging behaviour who haven't been moving on but have been doing the rounds, who have moved between services, often being evicted, then spending periods of time rough sleeping. And the reason why they haven't moved on is because they haven't been assessed as being housing ready because of their refusal to actually engage in services. And we've been trying to find solutions how to deal with these particular individuals ever since the pathway was launched in 2007. What we did back in late 2010 was we decided to invite bids from our providers and other interested bodies for time-limited pilots of cheaper and better service models. And an organisation called SHP, which was one of our existing service providers, a voluntary organisation, came to us and proposed to introduce something called a Housing First service for 10 individuals with multiple and complex needs who weren't benefiting from this pathway approach. We liked the idea of that and we agreed to fund it for a couple of years, and must admit one of the main drivers for us was the fact that they were offering to deliver this service to this very difficult group at a much cheaper rate than most hostel beds were costing to actually house these individuals. The people that were involved in the project development, my team, Housing Commissioning, then a team within Camden called the Housing Needs Group, who key to this because they're one of the main referral sources into the pathway, but also the people who assess housing readiness for people to move on. SHP, the service provider. Safer Streets team is the name of a team in Camden. It's actually an outsourced service provided by a voluntary organisation called CRI, who are the rough sleeper outreach team. Other pathway providers and stakeholders were also involved, as indeed were pathway service users, and also crucially private landlords who were providing the accommodation. With regards to project design, it's important to note that we weren't starting from scratch. We weren't starting from a blank page. The Housing First model is quite well established in the United States, but less so over here in Europe. But variants of it are starting to be introduced now in different countries, including the UK. When we launched our pilot in 2010, I think the only other Housing First service in the UK was in Glasgow. There are now more of those happening around the country, including in London with rough sleepers funded by the GLA. With regards to project design, the Housing First model works on these premises that housing readiness isn't necessary in order to access and sustain housing. You remove that requirement and some of the most entrenched and difficult individuals can be placed and maintained in independent accommodation with a high level of support available, but the only requirement is that they engage with tenancy support, not with treatment. That's the critical point. So this separation of need and treatment is absolutely critical. Independent self-contained accommodation is provided. The only conditionality that's in there is that the people pay their rent and that they get on with their neighbours. They don't upset the neighbours. They don't have to engage with treatment services, and that's one of the key differences. Very intensive support is provided, that's available 24 hours a day in terms of contact, but crucially not actually on site. In hostels, 24-hour support is provided, the staff are on site all the time. Clearly these people are living in their own flats and there aren't people living with them 24 hours a day. There were some unique design features to the Camden Housing First system. In the United States, Housing First services tend to take people directly from the streets and put them into their own flats. What we were looking at now was a Housing First service that complemented our pathway model, so this made it quite unique really, and so specifically aimed at people stuck in the second stage of the pathway for 3 years or more. Accommodation in the private rented sector rather than in the social housing sector, and accommodation sourced by the provider rather than the statutory body. The service has been evaluated by the University of York. The University of York have created a niche for themselves in evaluating Housing First services and tend to talk at conferences around the world about it. And they came in and did an evaluation of the Housing First service in Camden and concluded that it was very successful. Tenancies were being sustained by individuals who would never have been considered for independence otherwise. Very positive feedback from those service users, and of course from our point of view, good cost savings being achieved. In terms of learning outcomes, it's clear that the level of contact and skills of staff can't be skimmed. We're talking about very intensive support to individuals. There's certainly a need for diplomacy and working with other professionals who can see this as people with very bad behaviour bypassing systems and getting their own accommodation. And actually, this is particularly a problem in London. Sourcing those properties can be very difficult and has proved difficult up to now.
You talk about SHP as coming from the voluntary sector. Can you explain a little bit the difference between an organisation from the voluntary sector and the previous supply you had in this context?
It's not so much previous supply. The supply continues. So Pathway, this hasn't replaced Pathway services. This is in addition to Pathway services. And SHP are one of our providers of those Pathway services. So they run hostels as well. And the other providers of those services are a mixture of voluntary organisations like SHP, housing associations, and in fact the council has its own in-house team that runs some of those services as well.
I suppose what I'm asking is, what do the volunteers do in this? Where's the volunteering bit?
There's no volunteering. Voluntary sector doesn't always mean volunteers.
Okay, thank you.
Thanks very much. Just wanted to know, these people, if I've understood correctly, they go and they live alone in,
yes.
In this space, flat. Do you see that as a positive or a negative?
Good point. Obviously, one of the issues with individuals with these kind of support needs can be about isolation when they're going off and living on their own. And one of the things that the project has tried to do and been relatively successful in has been in plugging them into networks locally wherever they've moved. One of the key characteristics of this client group has been having lost contact with family and friends because of the support needs that they've had and the lives they've been leading. And one of the successes of the project has been encouraging those people to re-establish those contacts, and that's been happening in a number of the cases.
So they're actually given support and they're facilitated in
very intensive support. The project has worked with 10 individuals, and there's 2 full-time members of staff and a bit of a manager's time involved in that. So each of the full-time members of staff has 5 people that they work with, and particularly when they first move into their flats, they can be down there with them 3 or 4 days a week, working with them.